First of all, the awareness should come at the school level. Anybody who smokes usually starts to smoke between 15 to 20 years of age, and therefore it is very important for us to educate the school children what are the chances of developing cancer if they smoke. In India, it's the opposite. Even if a lady has a lump in the breast, for example, she is embarrassed to tell them that she has a lump in the breast. Very common myth is that cancer is the disease of elderly age group. It is not like that. It can occur in young people also. People assume that cancer is a death sentence. Cancer is not a death sentence anymore.
Cancer is a malaise across the globe. People have misconceptions about it. How does it happen? What are its remedies? How it can be cured? People try almost everything, right from medicines to alternate therapies. But we are here to debunk all of these myths, and we'll simplify it for you, for all our audience. And we have someone who has seen it all since past 2 decades. We are welcoming Dr. Nidhi Tandon from NH. Welcome, ma'am.
Thank you very much. It's a pleasure.
Yeah, thanks a lot. We'll start with knowing a little more about cancer. What are its early signs? And we should try to keep it normal for our audience so that they're able to relate with it.
Let me first start with what is cancer. Normal cells in our body grow, divide and die in an orderly fashion. When a group of cells start to divide uncontrollably, that is when a tumor or a lump is formed in the body. When that remains in the body for some time, it starts to spread to other parts of the body through blood and lymph when the cancer becomes advanced in stage. The cancer is growing at a very rapid state as of now. Worldwide, according to Globocan data, we had about 20 million new cases and about 9.7 million deaths because of cancer. Even in India, in 2020, we had about 1.36 million new cases, and it is increasing at a rate of about 13%. Which is very alarming. The early signs and symptoms of cancers are unexpected loss of appetite, unexpected loss of weight, a sore or a lump which is persisting and not healing, even if it is painless. If you are having a nasty cough or breathlessness or hoarseness of voice which is not going away, any abnormal bleeding, whether it is through the mouth, in urine, in stool, or just altered bowel habits, like initially you had constipation, now you're having loose motions. All these may be the early signs of cancer.
Okay. So we have heard this warning on the cigarette packs, and we know like it happens via tobacco, it happens through smoking. But are there anything else that really causes the cancer? Because the warning signs that we see are on only these two things.
Right. So smoking and alcohol intake are one of the most important causes of cancer. And a lot of patients do ask me that there are many smokers who do not develop cancer, and there are many non-smokers who develop cancer. Why is it so? So the best example is driving a bike with a helmet. If you are wearing a helmet, the chances of having an injury because of accident is very low. Similarly, if you're not smoking, if you're not consuming alcohol on a regular basis, the chances of developing cancer is low. But there are other factors which can lead to cancer, which are largely related to the poor lifestyle choices that we have. A diet which is low in fiber, high in canned and preserved foods, low physical activity, obesity, all of these factors are linked with cancer. There is a study which found that career women have almost a 2 times risk of breast cancer as compared to homemakers. Don't get me wrong, I'm a career woman myself, but what happens is with career comes the stress. With career comes either not having a child or delay in having a child, not being able to breastfeed the child, which all culminate into risk factors for cancer.
So I've seen in a lot of movies, and I've heard a lot about the different stages of cancer: stage 1, stage 2, stage 3. I don't know to what all stages it's come. I've been quite fortunate that I haven't had to experience it in my family till now. So can you simplify it for me? And how do we detect cancer at a very early stage?
So, at the outset, I would like to tell that each cancer has a different staging system technically. But for us to understand in layman terms, stage 1 is usually when the cancer is small and localized to the organ from which it started. And in this stage, either by a surgical resection or by giving strong doses of radiation, we are able to get rid of it completely. Then comes stage 2 and 3 when it becomes either bigger in size or it spreads to surrounding structures or lymph nodes. In this stage also the cancer is curable, but it does not usually end up with one modality. We have to add either chemotherapy to surgery or we have to add radiation therapy to surgery, and sometimes even both. Stage 4 is the last or advanced stage when the cancer spreads from the organ from which it originated to any other organ in the body. That is when cancer is not curable, but in that stage also now we have enough methods of treatment with which not only we can prolong the life of the patient, but we can also add quality of life in the years he have. And this is the reason why screening for cancer is very important, because if we screen cancer, then we are able to detect it at an early stage, and therefore the cure rates of cancer largely increase. There are certain cancers like breast cancer, cervical cancer, prostate cancer, colon cancer, for which screening has been recommended by guidelines, and if we detect the cancer at an early stage, we are able to cure much more patients.
Ma'am, one question just came to my mind. So let's say, does age have anything to do with the recovery part of cancer? Let's say a person of 30-year-old, he is diagnosed at a cancer at a later stage. Will it impact his or her recovery? And is it easier for a younger person to recover fast as compared to an older person?
It's not the rate of recovery exactly, but it is the tolerance to treatment. A young patient who has no comorbidities, like he's not diabetic or hypertensive or any cardiac history, is much more likely to tolerate even the aggressive treatment, and that is why his survival is likely to be better. But we should also note here that there are certain cancers like breast cancers and ovarian cancers in which we have seen that if they are diagnosed at an early stage, they are of a much more aggressive type.
So while we have already spoken about the age, does gender have to do with anything with cancer as well? Because women and men both have different roles. And so, I mean, because you have been in this field, what's your, I would say, an estimation? Like, who's at a more higher risk of cancer, a male or a female?
So, males overall have a higher incidence of cancer as compared to females. But now the things are matching up. Males have a high risk of head and neck cancer, lung cancer, colon cancer, and prostate cancer, while women have a high risk of breast cancer, ovarian cancer, and cervical cancer.
I just wanted to understand how India is poised to screen the cancer patients, because we have such a young population at an average age of between 28 to 30. You would definitely want to save them from such, I would say, grave disease. So is India really ready? And how is it compared to the US? Like we hear about a lot of good practices in the US. So how do you compare both India and US in terms of screening?
So I had the privilege of working in India as well as in United States. And what I found was that the general public was much more aware about cancer in the United States as compared to India. The screening programs which we just discussed are also available free of cost under insurance in the United States. And hence, people are more forthcoming to get themselves tested before they become symptomatic. In India, it's the opposite. Even if a lady has a lump in the breast, for example, she has to either take her husband or father or brother or son to take her to a doctor. And she is embarrassed to tell them that she has a lump in the breast. Add to it the social stigma related to cancer's diagnosis and treatment in our society. I had a patient who was detected with cancer, but she did not start her treatment because her daughter's marriage was fixed. And she was worried that if her in-laws get to know about this disease, they may have a doubt that it could be hereditary, and then the marriage could have been broken off. And because of this, the treatment was delayed for a couple of months when the disease progressed. So that is the reality of the situation in India, which we have to fight. Also, what happens in tier 2 and tier 3 cities is that first the patient will go to a general practitioner who will refer to a specialist who will do a scan and then diagnose that there is some abnormality. And finally, by the time the patient reaches to an oncologist or a tertiary care center, it is already 3 to 4 months. So this delay is also something we are struggling with.
Okay. And I also wanted to understand, like you quoted one example of the social stigma. We also, in India, we are a huge movie consumer and we see a lot of movies and there are good messages in that movies. But still, that awareness still hasn't gone through. And I'm not going to point out tier 1 or tier 2, it's across India. People still have that hesitation to support a cancer patient. What do you think, like, where is India lacking in terms of, having this huge cancer awareness programs? As far as I know, there have been a few movie stars who have come forward to support this cause. And every now and then we have some sort of league, some sort of fundraisers, but still this is not going. So where do you think India is lacking in terms of making, in terms of awareness around cancer?
So first of all, the awareness should come at the school level, especially at the high school level. We can take example of smoking. Anybody who smokes usually starts to smoke between 15 to 20 years of age. They do not start to smoke at, say, 35, 40, 45 years of age. And therefore, it is very important for us to educate the school children, the high school children specifically, what is the risk of smoking? What will happen if they smoke? What are the chances of developing cancer if they smoke? And what I believe is that instead of waiting for a person to come to the hospital, which might be difficult in the Indian cultural society system, it would be more feasible if we are able to reach the general population. For example, we have vans with mammography setup and pap smear setup, which are mobile and which can go from house to house to get the ladies screened. Also, though the movies and the TV series are talking about cancer, but I feel that they present cancer in a very sad and a very distressed way. They show that if the patient is taking chemotherapy, the patient is completely bedridden and with no energy left whatsoever. However, I do have patients who are going to work while on chemotherapy, except when they take a leave when they have to come and take the session of chemotherapy. Apart from that, they are working. So this makes the general public believe that if I have cancer, it's a death sentence. And that is why they are not able to reach the hospital and get the treatment started.
So what do you think? Like, India has advanced a lot in the IT sector, and I've seen India has also seen an influx of medical tourism in past decade. So is India well equipped to manage diseases like cancer?
I would say that everything which is available in the West, all those technologies are available in India. Apart from a couple of medicines which we still need to import, we have the training and the expertise of performing all the procedures and administering all the medications. In fact, what happens is that a normal oncologist in India sees much more number of patients, and even the cases that he gets to see are more advanced in nature as compared to the West, and hence the experience in treating complex cases is even higher. There are certain advancements like the use of targeted therapy, which will go and attach to a particular receptor on the cancer cell and therefore will not have side effects like the chemotherapy has. Or there is something called as immunotherapy, which will activate your body's immune system to fight against cancer. All these facilities are available in India. In fact, we also have something called as scalp cooling, which will help to reduce hair fall during chemotherapy to an extent of about 60 to 70%. So everything is available in India, but the problem is most of it is limited to metropolitan cities, to tier 1 cities, and not to the tier 2 cities, tier 3 cities or villages.
Yeah. So from awareness or lack of awareness, I should say, a lot of myths also arises. So I want to debunk those myths. So what are the myths that you kind of, experience in your daily life? Your patient must be asking multiple things, or in, whenever you are teaching any students must be asking multiple things. So can you just, bring out some of the myths that and debunk them for our audience?
So the first very common myth is that cancer is the disease of elderly age group. It is not like that. It can occur in young people also. Cancer only occurs to those who are smoking or taking alcohol. No, cancer can occur otherwise also because of the factors we have discussed before. The third and very common myth is that if a lump is not painful, it is not cancerous. In fact, it is the other way around. Cancer lumps are usually painless to begin with and become painful only in later stages. One common myth associated with the diagnostic part is that doing a biopsy will lead to spread of cancer. Biopsy is a very essential procedure which not only helps to diagnose cancer but also helps us to evaluate which is the best option of treatment for this patient. So apart from a couple of cancers like liver cancer and kidney cancer, biopsy is usually mandatory in all cancers. A very common myth which might have been exaggerated by movies or social media is that people assume that cancer is a death sentence. It is not like that. It is not that if the patient is on chemotherapy, he would be bedridden in a lot of pain. In fact, it is the other way around. Cancer is not a death sentence anymore. With treatment, not only the life increases, but the quality of life becomes better. I have many patients who are going to work when they are on chemotherapy and they just need to take the leave on the day their session is supposed to be.
So what do you think are the key steps to diagnose a cancer patient or to diagnose the cancer?
A very important thing over here is that the patient needs to go in a hospital which is specialized to deal with cancer cases, because the role of a specialist in oncology is very pertinent here. We initially start with doing either a biopsy or doing some blood test to see the level of cancer in the body. This is followed by doing an imaging like a PET CT scan or a CT scan or an MRI scan to find out where all is the disease spread in the body. Once we know what is the type of cancer based on the biopsy and where all has it spread based on the PET CT scan, we decide what will be the plan of treatment for the patient.
Okay. Now, coming from diagnosing the cancer to a more thoughtful process, I would say, it's better to be safe than sorry. So I just want your word in, what kind of diet people should follow to avoid cancer or to, kind of delay it.
So I'll only talk about what is evidence-based. Otherwise, for every single thing, we have a risk of a disease associated if we go according to social media. A diet which is rich in fiber, a diet which is rich in fruits and vegetables is good for prevention of cancer. As compared to this, a diet which is rich in canned food, preserved foods, processed food has a high risk of developing cancer. Red meat like beef, mutton is associated with a higher incidence of colon cancer.
We have heard the stories of, people healing themselves from cancer with just, keeping their mental strong. I know that happens in a lot of cases, but have you come across any of your patients, that have kept steady, and does it really help, because when you have cancer and it's a normal thing that people get sad. So if they keep up their own, I would say, mental health, or if they are mentally very much sound, will it really help in the treatment of cancer?
In my experience, even at the same stage of cancer, the same method of treatment by which it is being treated, the way a patient thinks completely changes the prognosis, completely changes the outlook he or she has. I had a patient who was diagnosed with a cancer of ovary. Her long-term dream was to do scuba diving, and it was only when she was diagnosed with ovarian cancer she realized that she had kept her dream at bay for a long time. And during the entire treatment, she was not thinking about cancer, she was not thinking about chemotherapy. All she was thinking about is, as soon as this is over, I need to go back and do scuba diving. And I'm very delighted to tell you that she did that after completion, after being cured completely in Andaman, and she did send me a picture of the same.
So, this was about patients in focus. A lot of times families do also suffer, because they have to be at the side with them. They also suffer emotionally because they have to, they'll be parting ways with someone, very close. So does hospital or any sort of programs are there for these people? Do they get any sort of assistance?
There is a definite term called bystander's fatigue. Cancer is a difficult diagnosis and it requires a long duration of treatment. Not only it is emotionally draining for the family, it is also financially draining, and it also makes the bystander to take leaves from offices, not able to spend time with his family while taking care of his parents, for example. Hence, we do have a oncopsychologist who deals with not only the patient but the patient's family members as well to help them deal with the situation.
So, I wanted to ask that it's been an illustrious career for you. You have seen the paradigm change completely in healthcare. So, what are the technical advancements that you believe have, changed the way that you have provided more, or I would say better attention to your patients than before?
One of the very important technological advancement is the use of electronic medical record system. And because of this, we are able to crack the records of the patient, crack the investigations of the patient, as well as the details of treatment of the patient for long term. A component of Atma that we use in our hospital is Adi, where apart from assessing the records and the clinical details and the reports of the patient, there is a facility where we can directly interact with the patient's relative at any point of time, even in the night.
So I should refrain myself from asking this question because all of your cases are challenging. But still I want to ask, like, what is the most challenging case that you have ever handled as an oncologist?
One of the most challenging and unforgettable cases that I managed was a 27-year-old lady who was pregnant with a 6-month-old child when she was diagnosed to have tongue cancer. At this point of time, the ideal method of treatment, which is surgical resection, was not possible because we have to give anesthesia for a long duration to complete that surgery, and this could have led to serious problems with the 6-month-old baby inside. Hence, what we decided after taking confirmation from the patient and the family was to give very low dose of chemotherapy, just enough to keep the disease in control till the time the baby grows. And once the baby was fit enough to be delivered, first a cesarean section was performed to deliver the baby, after which the surgery for the tongue cancer was performed. So it was really challenging, but we also went out of the way to help the patient, and the patient also trusted us and was ready to be a part of the battle.
As a marketer, I almost look at everything from a marketer's lens. So, and because that is, pretty much ingrained in my subconscious. And similar to that only, I wanted to understand, what is an oncologist's life beyond hospital? Like, do you have the same kind of reservations or restrictions for your family as well? Do you prohibit them from doing certain things? How is it that?
Certain things that I'm very particular about at home is use of canned food, use of preservatives. For example, giving anything to a child which is packaged. Most of them do have preservatives, and a lot of them have been associated with serious diseases including cancer. So this is something I'm very particular about at home, not to use anything which is canned or preserved.
So as we also pointed out earlier, that families are the one that gets impacted the most with people having such diseases. But at the same time, they have to take care of the patients as well. And what should they do, to help the patient out and to support them in this time?
So one of the things that the family should do is not to take cancer as a disability, not to make the patient feel that he is dependent on them because he is diagnosed with disease. Of course, if he has a problem, they are there to support him. But if he is feeling fine, there is no way why can't he do his day-to-day activities, why can't he go for a walk, or why can't he go for a swim. Also, the family should not shy away from telling others about the diagnosis, because it makes the patient feel very lonely and secluded, and as if he has done a mistake by having this diagnosis. So apart from the physical and emotional support that they provide, they should make it possible for the patient to lead an independent lifestyle.
Going back to your career path again, so you've been with Narayana Health since quite a long time now. What do you think Narayana Health has excelled in doing better as compared to other medical institutes in India?
All the technological advancements, whether it may be robotic surgery or minimally invasive surgery or stereotactic radiation therapy, immunotherapies, targeted therapies, everything is available in Narayana Health. What takes us at par is that we have a rigorous system of taking every patient to a tumor board where a surgical oncologist, a medical oncologist, and a radiation oncologist sit together at the time of diagnosis to formulate a plan of treatment so that everything is going on in collaboration with each other.
So, if I have to explain it to my audience in a simplified way, they don't have to run to multiple doctors in different days or different days. They will get all the doctors in one place.
So once a week for every specific type of cancer, we will have a meeting where all of us will sit together and decide, and whoever has the patient approach to will outline the treatment to the patient. And hence, of course, he would not have to run around and he would be guided to the best treatment option available for him.
So I think with this, we conclude this conversation. Thanks a lot for your time, ma'am. It's been extremely informative for all of us out here, and I'm sure it will also guide our audience.
It was lovely talking to you. Had a wonderful time. Thank you. Please do like, share, and subscribe to the channel Healthcare Off the Clock.